All right. Well, hello. Thanks for joining us. I am Cindy Jarvis with Engel and Volkers, the Western Frontier part in Whitefish Shop. And I want to introduce to you Dr. Sam Madeira, who specializes in men's and women's hormone therapy in Whitefish, Montana. And I would like to ask Dr. Sam Madeira first to tell me just describe your practice for us.
Absolutely, yeah. So I specialize in men's and women's hormone health optimization. So that could include thyroid, adrenal health, reproductive hormones, so testosterone optimization mostly for men, and female hormones and all the above for female and men. So people could be having symptoms of fatigue, decreased strength and endurance, or loss of lean muscle mass, or just not getting the improved muscle mass with their workouts. They could have low motivation, potentially even sexual dysfunctions or low libido. That's not a requirement to have low hormones. And it could just be one of those symptoms. And maybe they just don't have enough energy to play with their kids or grandkids. And, all my patients are adults. I've been getting more and more younger patients, so in their 20s and 30s, which may surprise people that they can have low hormones too, and they do. So you don't have to wait until you're 50 or older to optimize your hormones. You can do it sooner.
That's good. Good to know. What do you mean by an integrative approach to your health? What does that mean?
Sure, yeah. Integrative means that we don't just use one type of therapeutic intervention. We may use prescription medications as needed or compounded medications as needed. Some of those medications may be compounded bioidentical hormones in a capsule, cream, or injection. They also may be more conventional retail pharmacy prescriptions that you get at your neighborhood pharmacy. And I mean, that could even include antibiotics or other medications as needed for a shorter period of time. But it also includes, your lifestyle, getting your lifestyle healthier. It includes herbal medicines, natural medicines, nutrition, exercise, and nutritional supplements. So it is truly integrative, meaning we're bringing the best of all types of medicine, and we don't basically, we're not prejudiced to one type of medicine. However, we want to cause the least amount of harm with every intervention. So obviously some medications have a lot of bad side effects, and most of the people I work with are aware of those side effects, or aware that there are side effects with medicine, and they want to use the least harmful prescriptions.
That's good. So you treat the whole body basically too.
Yes, exactly.
So, are there you were talking about ages, so really there's any age that can be a benefit to you, because we probably aren't even aware, right, of our hormone levels unless we specifically, try to find that out.
Yeah. I mean, basically the best way to figure out if you have low hormones is you can take questionnaires. I do free discovery calls with patients, so usually I put them through a questionnaire like that. Mm-hmm. And then to kind of like pre-screen them to see if they're a candidate for getting their hormones optimized, or if they have symptoms of low hormones. And a lot of people think that normal aging equals feeling worse or having a disease or a condition like high blood pressure, weight gain, fatigue, joint pains, etc. And everybody around them, their family members, their community just says, oh, well, Mr. or Mrs. So-and-so, you're just getting old. Well, normal aging, actually, there is something called inflammaging, where you can have more inflammation as you age. However, a lot of the diseases that people have as they age are actually caused by metabolic syndrome, gut dysbiosis, low normal hormone levels, and you can kind of prevent or reverse some of these conditions when you optimize your hormones and your lifestyle and change your lifestyle. A lot of the chronic illnesses that people have today, like diabetes, for example, are not diseases in the sense like hepatitis C is an infectious viral illness of the liver. diabetes, type 2 diabetes, is caused by your lifestyle. So yes, you could have genetics where you're more sensitive to eating lots of carbohydrates or something like that, but it doesn't mean that you need to get diabetes just because your genes say that you're a little bit more sensitive to something, and you can change that with your lifestyle and you can reverse diabetes with your lifestyle, and lose weight and do all those things that a lot of people find really hard to do on their own. Usually you need someone who's like a coach, a health coach, combined with a doctor, or a doctor who does health coaching too, kind of like me, and to get through those kind of blind spots or plateaus that people have a hard time breaking through on their own in their health. And it's really hard to do that kind of stuff on your own, especially when you have a chronic condition. And a lot of the habits and lifestyle patterns that you've created have caused your state of feeling unwell. So it can be a real problem.
That's really good to know. That's very interesting to me, very specifically. So my next question would be, why have you chosen Whitefish? I know you have an established practice in Seattle. Is that correct? And then you established one here in Whitefish. What made you come here?
Yeah, so my mom has lived in Whitefish since 2008, so almost 13 years now. And when I was in naturopathic medical school, I would go to Whitefish once to 3 times a year, winter and summer, and ski and hike. And I grew up in small town New Hampshire and small town Vermont, so I'm a small town, guy, and I like a lot of being around a lot of nature because that's how I grew up. And my goal was to be in Seattle for school and then leave. However, life always takes different turns. I'm sure people can relate to that. Mm-hmm. So I started my clinic in Whitefish after my mom was basically begging me to do that, because there's only so many naturopathic doctors in the Valley, and there's seems to be a lot of need for what I do. And basically in end of March 2019 is when I started being in Whitefish more frequently, and basically anywhere from 10 days to 3 weeks at a time. And then in 2020 I was there most of the year, so over I think 5.5 months or 6 months, and really love Whitefish. I love the ski resort. I love to ski. I've been skiing my whole life, and it just seems to kind of suit my recreational needs, as well as the community and friends that I've made that are part of the community are very generous and giving and welcoming. So pretty warm, friendly community to be a part of.
Well, I think that we're pretty lucky to have you come to our area and be a benefit and a help with, health in our area. I agree with you. We don't have enough of more of a natural approach to health, and I welcome you, and I'm really glad that you're here.
Thank you.
I am we'll sign off now. We thank you for coming and watching. Dr. Sam Madeira can be located at his health clinic, the Apollo Health Clinic in Whitefish, Montana. I would advise you to do that little survey and find out if you're a candidate for his treatment, and then schedule so that you can be able to see him or meet him when he's available here. Thank you again for joining me. I sure appreciate it. I'm Cindy Jarvis with Engel & Volkers, the Whitefish Shop. Thank you, Doctor.
Thank you.